When I'm walking down the street.
I do want to say to Doni and many of you in this room that over a very long career in this city, all of you have helped me and my colleagues tell the truth and to try to tell.
I may not look like you and you me, but
my head up.
I'm from South Carolina, so I just
got it.
What does this event mean to you, Miss Peggy Moore?
Oh, my heart.
Happy 20th anniversary.
My heart is about loving up on my sisters. Do you know what it feels like to have your sisters in the room? Done.
And that'll be different and unique. I'm gonna be the best me I can be by letting His glory shine through. I am beautiful, I am blessed, but not just what you see in the flesh. I'm free from people, free from myself. There's
The doctor lived next door to the janitor, to the reverend, and the lawyer. We were together. Now we get so high and mighty that you create stress for your society because you don't like poor black folks either. That's a health problem. Get yourself together so I can stop being taking care of geriatric people and get back to pediatrics. I thank you, Doni, for all you've done. Let's keep doing it all the more.
letting His glory shine through. That'll be you, that'll be me, that'll be different and unique. I'm gonna be the best me I can be by letting His glory shine through. And I dare you, I dare you, I dare you to be you.
First name's Doni, last name's Glover, entered the winning for the long haul baby. Okay, do you know what yesterday was? Besides Dr. King's birthday, smarty pants. Yesterday was the day you had to put in your health insurance information. And if you didn't, oops. But fear not, because we have the one and only Ashli Moore, who can help give us some information. Good morning, Ashli. How you doing?
Good morning, Doni. I'm well. How are you this morning?
Good. What happened yesterday from a health insurance perspective?
Oh, so yesterday was the deadline to have any changes or updates that you needed in, especially for the people through using Maryland Health Connection. So there's a specific time for enrollment periods. And a lot of times, if you don't get your information in, updated, and changed by that enrollment period deadline time, they either roll you over and you're stuck with what you had, or if you're in the process of recertifying, there's a good chance you'll be stuck without insurance. So yesterday was the deadline for that type of information to be entered for all of those who use Maryland Health Connect services in order to acquire health care.
What do you do, Ashli?
So my business in particular, I work for the provider. I like to summarize it as, when it comes to the healthcare providers, my business is an enhancement, but when it comes to the patients, I'm more of an ally. So although I work directly with providers most of the time, my consulting business does a lot of connectivity. I've been working in healthcare for as long as I can remember. I won't tell my age, but I really strive to help small private practices. Larger health systems, a lot of the times they have the resources, they have the capacity, they have everything in kind of an all-in-one setup. But sometimes I'm one of those people where sometimes less is more. And I always have noticed within a private healthcare setting, I personally, from a professional and personal perspective, I feel like the care is a little bit more personable. I feel like you become a little more connected with your provider. And I just feel like the smaller business model creates more unity between the provider and the patients. One of the problems that's going on right now is everyone's thinking accessibility. With telehealth, people have accessibility to bring the knowledge to access that accessibility, then it counteracts the productivity of accessibility. So my goal is to work with the provider, assure and help them to maintain smooth, good operations to provide quality care to their patients, because it goes both ways. You got to think of it like this. If a healthcare provider's office is completely well put together, operations on point, all of their reporting is well, they're doing well, but none of the patients know how to utilize any of their services, they can't really benefit from that. And then if you have a bunch of educated patients, but you have a provider's office who can't accommodate those educated patients just because of the capacity, some of the questions people have, providers take on a lot of heat for insurance companies. A good example is you get a bill, you don't realize you have a deductible, or you don't know what a deductible is. And then the first person you call is your doctor's office. Well, your insurance company tells your doctor's office what to bill you. A lot of times the doctor's office can't really explain to you for legality reasons. That's between you and your insurance. So then people find themselves having to call the insurance company. That's a 2-hour phone call right there. And then they got to call the provider back. If I can work as the connection between the provider who has good operations and the patient who has a responsibility to be educated and a responsibility contractually to their provider, if I can pull that together, then everybody benefits all the way around. But you can't really have one without the other. Sorry, I'm a talker. Another big thing is medical errors. Medical errors is the third leading cause of death in the United States of America as of 2024. And the key thing to medical errors is, in the definition of a medical error, it is preventable. So that means 200,000 plus people have died due to a medical error. Now, we're not talking about negligence. We're not talking about somebody did something wrong or malpractice. That is something different. I'm talking about a genuine error. But the key word here is preventable. 60% of those deaths were caused because of miscommunication. That means if there was someone simply like me to just communicate appropriately to the appropriate people and connect providers and patients and providers and insurance companies, there's a good chance that there's 60% of people that could have been saved. And to me, that's just absolutely ridiculous, just based off of a lack of information.
Ashley, you're going to speak at our Black Wall Street Expo in February. Why should people come to hear you and the others on the panel? We're going to be talking about things like health insurance for entrepreneurs.
So one of the things that I think about is, aside from the fact of being a healthcare professional, I'm also a patient. I have a lot of background. I have my own family. We all need healthcare. I have children, a husband. I understand both sides of it. And the other thing is where we're requiring and empowering people to have health insurance benefits, whether it be Medicare, Medicaid, commercial insurance through your employer, whatever you have, they don't know how to use them. They don't understand them. So to obligate or force or mandate somebody to have something that they have no idea how to utilize, that they are paying for, is ridiculous to me. So if I could just be able to educate the community about simple things, like the words like copay, coinsurance, and deductible. Half the world might not even know what that means, but half the world has insurance. These are small things. And again, I mentioned before, patients have a responsibility to their healthcare providers when they sign contracts and they sign on as patients. And I think sometimes we forget, or because of lack of knowledge, patients have a hard time maintaining that responsibility, not because they don't want to, but because they don't know. You don't know what you don't know until you don't know. So you have me here where I can give you that information. You can take these bits and pieces. You might not be able to know it like the back of your hand where you can identify if something is wrong. But at least when you get a bill, when somebody's asking you for the little bit of money that we do have in our pockets, you would like to, and you deserve to understand why and the importance of it, where it's being applied to. And that's something that I personally think is vitally important for the provider and for the patients. education, knowledge.
You mentioned the term that I've not heard, co-insure.
Co-insurance, yes. So a good example I typically,
an
I'm sorry,
insurance to go with your insurance.
No, not even a little bit, Donnie. So we have co-pays. Some insurance plans have co-pays. They're typically set prices that are applied to specific services. So for instance, if you have a co-pay on office visits, every time you go to your doctor to have an office visit, they charge you a set standard amount, $25. And that's not your doctor necessarily charging you. That's what your insurance is telling you you owe and telling your doctor you owe. So normally there's a copay. It's a standard $25, $50 fee that you're typically aware of that you pay at your visits. Then you have a deductible. Medicare, again, I focused on the elderly and the underserved quite frequently, and Medicare is a big one. Medicare, there's a deductible at the beginning of the year. I believe for this year, it is $255, if I'm not mistaken. And what happens is when you go see at the beginning, typically it's the beginning, January of every year, that's typically, because some do a plan reset, but typically your insurance deductible resets. So the deductible, the $255 Medicare deductible is the amount the patient has to pay out of pocket before Medicare will cover them at 80% and leave them with a 20% co-insurance. So the co-insurance is the difference that you have to pay as the patient after Medicare applies their 80% after you have paid $255 out of pocket. And co-insurance is typically more of a percentage. So it's not always going to be the same, and it is applied to different services. So that kind of explains the difference between the deductible, which is the amount you have to pay out of pocket before your insurance company will even address some things. Your co-insurance is your responsibility after your insurance has addressed certain things. And your copay is your responsibility when you go and it's applied to specific office visits. But each one is different. Everyone is different. And it's very important that people know the difference, because if you don't, you can't keep track of what you're paying. You don't know which benefits have been reached. And then when people speak it back to you, you have no idea. A lot of times patients spend 2 hours trying to get to the insurance. They don't get adequate, or they get insufficient help, or they don't know. So then they call the doctor back and they repeat what they heard the insurance company say. And then the doctor's office goes, no, that's not how it works. So then now you got to call back. We got to take all of that out. If somebody who's knowledgeable as myself can do all that legwork for these people, for these patients, not only does it benefit the provider, it benefits the patients. Doctors don't get paid if they're not listed as your primary care provider on your card. If you have Medicaid and you have Dr. Johnson listed on your card, because if you don't select a primary care provider, they will assign you a random one. So if you have Dr. Jones on your card and you go to make a visit with you and your children, and you go to see Dr. Johnson, Dr. Johnson's going to tell you, oh, well, in order for us to see you today, you're going to have to call Medicaid and you're going to have to change it. So now everybody's inconvenienced. You Ubered there, you got your children, you took them out of school, you took a day off of work. If you would have just known this ahead of time, it would have alleviated all that frustration. And that's what I'm hoping to do, alleviate the frustration for the patients and bring that connectivity and communication with the providers. It benefits them financially, it benefits the provider operationally, and it benefits the patient all the way around.
So if people missed yesterday, what do? If they miss filling out the insurance for here in the state of Maryland Health Connections, what do?
So
are they out of luck?
There are certain circumstances that qualify people to update or change. One of those qualifications is if you were currently insured and then you lose insurance. So if I had insurance through my employer and then for some reason they stopped offering it or whatever the case may be, when a change of that nature happens, they do give you the ability to apply outside of the enrollment period. Another example of a change is they call it a qualifying circumstance. Another example is if you get married, if you have a child, if someone's been added to your household, anything that kind of fluctuates your income and ability to have medical insurance, they will ask you to upload a lot of the times to the Maryland Health Connect those documents, and they will determine if those documents are sufficient to qualify you for that change. Outside of that, unless something happens to your income, you're kind of stuck with what you have until the beginning of the next year. But again, when circumstances change, you do have that flexibility to see if you qualify and what plans you may qualify for when those circumstances arise.
Suppose you get fired or you quit.
If you get fired, you absolutely, it's considered a loss of insurance. So regardless of what the circumstances on how you lost it, that is normally a qualifying circumstance. Now, the specifics of that qualifying circumstance, it's up to them to determine what they're going to accept as qualifying. But that's absolutely a reason that you would be able to try to do an enrollment outside of the enrollment period. The important thing is to have the appropriate documentation as well.
Why does Maryland Health Connections leave you on hold for an hour?
So I can't speak for them specifically.
No. You're the expert. Why they send you in this big ass loop? You go to the website. Oh, well, no. You call the number. Oh, just go to the website, and you go to the website, and then it's like, hold up. I pay y'all people. My taxes pay for the state of Maryland, right?
So.
And then they make you feel stupid, like you didn't know this. No, hell no. If you answer the damn phone.
I'm big on face-to-face communication, and this is one of the reasons I mentioned smaller provider offices. Just I feel like they create a more genuine sense of care. But for that reason, everything has become so technically advanced that at times it's inconvenient. Like I said, sometimes less is more. So when we think about healthcare and these websites and technology, from a government perspective, things get looked at from the many. So you want to weigh how many people can get through versus how many people can't get through. And chances are the people who can get through are the many. So that leaves a gap for the people who can't get through. Just because it's a difficult system, there's one-offs, blips, technical issues. A lot of times Maryland Health Connect doesn't realize there's an issue until it gets reported by hundreds of thousands of people. But by then it's already affected you. So
I don't get that in an age of technology. I don't get that when people are making exorbitant salaries. I don't get that. I don't get that when you claim you're here to serve the people.
And that's
I don't get it.
You hit the nail on the head. You said claim. So this is one of the big things I focus on that I mentioned earlier. There's a difference between accessibility, meaning we make this service accessible to X amount of people. That means everybody, not everybody, but the majority has access. What good is that access if you do not know how to utilize or get to that access? So statistics, you gotta think of it from a wide perspective. Yes, they're saying telehealth is great. This is great. Technology is great. Use it. It makes everything quicker and faster. And it does for the many. But what people don't realize is the one-offs and the things that get slipped through the cracks and these little blips that individual people have. Eventually, that is going to become the many if we don't address them. But again, that is what I'm here for. I wouldn't expect a person, and this shouldn't be the way it is, but it is, and we need to find a resolution, and that's what I'm here for. No, these things should not be extra complicated. No, these things, especially when the tax dollars are going into them. But the fact of the matter is, they are. And if you have somebody to explain them to you, it does things just like you said. You can navigate a little easier. I have direct connections and direct people. I can get things through a little easier. And no, it should not be that hard. But the fact of the matter is, when you have hundreds of thousands of people on a database, there's realistically, there's no telling what could happen. We hope for the future, but there's a chance that anything could go wrong. But we don't know until we roll it out and it goes wrong. My goal is to be preventative. We have to fix things like that on the front end. It's okay to be reactive, but if you can be proactive, it mitigates the disaster. People are so focused on these big, large issues at hand, and I understand that. But if they address some of these issues when they're minor, they don't become large, and that's my goal. We don't want to wait till we have lawsuits and a bunch of people on the day before enrollment that can't get in. That's not efficient. What do we do to stop that from happening? If it does happen, how do we get through it and make sure it doesn't happen again? It's about learning. Nothing's perfect, especially with technology. But if I can help connect that gap and alleviate that frustration you just there mentioned, even you, for instance, you needed something, you were having a hard time, took you a long time to do it, got it done within 24 hours. You know what I mean?
Why didn't it work?
Knowledge. Sometimes it's about knowledge. You need to really read through these things. And I'm going to be realistic. These websites and stuff, they are extremely convoluted, especially if you're not tech savvy. For the elderly community who,
that's what about the elderly?
So that is one of my primary focuses. My father passed away a couple years ago, and I am a healthcare professional. I know how these things work. I'm versed in it. I couldn't forget it if I wanted to. But when my father was dying during COVID, it really shed a different perspective for me on the challenges people have in his circumstance. Because if he didn't have myself who knows about these things, if he didn't have my sister who knows about these things, beyond a common knowledge, I thought to myself, where would he have been in his most vulnerable state of life? Who would have helped him? How would he have navigated? When they told him this wasn't covered and it was, who would have advocated for him? Even telehealth services, they're great, but you can't say that across the board. So my goal is to help the elderly and the underserved community so we can get to the accessibility and we can have the knowledge to not only work through these things, but come to a resolution to be efficient when we are having these problems. I can't tell you why Maryland Health Connection has the problems they have. But what I can tell you is I'm here and I'm willing to help navigate and fix them and to mitigate them. And that's my goal.
What happens if you have no health insurance and you have to go to the emergency room?
So the emergency room in hospital is a bit different industry than private practice. I will tell you this, for the emergency room, and one of the reasons the emergency rooms lose so much money and hospitals have such a large loss in their receivables is because you are required, the emergency room is required to see you regardless. That's not to say that you're not going to get a bill. That's not to say that they're not going to charge you. But what I'm saying is if you have an emergency and you are uninsured, regardless of what that emergency is, whether you walk into the emergency room or whether you come by ambulance, they are obligated to care for you. They cannot deny you care. I learned that because years ago, I graduated from the old school Baltimore, Lawrence G. Paquin High School. And we used to have a medical office within the school for the kids and that attended with children. Well, one day outside of hours for me to get to my doctor's office, I had to go to the emergency room. Mind you, I was 15 when I was pregnant with my first child. So I'm about 16, young baby. I went to the emergency room. I won't mention which one, but due to my lack of knowledge, after sitting there for about 4 to 6 hours, I was told that they wouldn't see my 3-month-old baby because I didn't have medical insurance. My Medicaid had expired. Now, mind you, I'm 16 with a baby, no knowledge, not a vet. I don't know enough to debate what's happening. Well, I left and, I go home and sister, what's going on? I explained to her what was happening. And that's how I became very familiar with that rule, because in no way, shape, or form can you be denied care. in an emergency room setting. Now, the urgent care centers, those are a little bit different. But when we're speaking specifically to an emergency room department connected to a hospital, that is something that's just given. But again, expectable if you don't have insurance.
Why is that so? Because they get state money?
Why? I don't understand the question.
Why must a hospital see you?
So again, I deal specifically and mainly with private practices. Specifically why that is for the hospitals, I could not tell you. I would like to think, based off of my knowledge, that at the end of the day, yes, dollars and money, you need it to run a business. But when you're talking about the health care industry, the words are right there in the title, health and care. These are two things that are mandatory. And there is an ethical piece that goes along with healthcare. The providers have an ethical responsibility. The CEOs and the people who run these companies and health systems have an ethical responsibility. And at the end of the day, if you make the people feel as if you don't have an ethical responsibility, why would they even take the time to deal with you? So it's important that they maintain that image and that concept of, yes, this is a business and we have to operate, but we are still healthcare professionals here to provide health care. So, it would almost be a disservice to the industry to start cherry picking people based on their needs of care and life saving needs based off of insurance solely. That's just not an ethical decision to make.
Do Black people get treated more greasy than white patients?
Well, I want to say generally there is a difference in the care, but that's not a question I can answer from a general perspective, because you have to talk about area. What communities are we? Because if we're speaking about West Baltimore specifically, I could tell you that the access to specific healthcare is different. Telehealth has changed that quite a bit, but where I've worked in Baltimore County, I've worked in Tennessee, I've worked in Cape Cod, Massachusetts, where I'm from, I've seen all types of demographics of people, especially being a Black woman raised in Cape Cod, Massachusetts. My family is from Baltimore. My mom's 80 and graduated from Frederick Douglass High School. I've been coming to Baltimore since I was 5. So this is where I've been my adult life. This is where I graduated high school. This is home for me. So if you're speaking with Baltimore specifically, I can probably answer that question a little bit better. But to give a general broad perspective, it really depends on what community you're looking at. And I wouldn't use the term we get treated more greasy. What I would say is, because of our lack of knowledge and the lack of the concept of the insurance that we have, it does leave us open and vulnerable to be susceptible to be treated that way. But if you know what you're doing and you know your responsibilities and you know what's expected of you and you know what you signed when you hooked up with these insurance companies and these providers, that gap closes a bit, because now you can advocate for yourself. So I don't want to say, Black people get treated more greasy. I don't want to say that. But what I want to say is we are more vulnerable because we have a large lack of knowledge about how to prevent ourselves from being treated greasy.
Tell us about your company.
So I've been working on my business for about 10 to 12 years now. I just became completely legalized where I could roll out my services. It took me a long time to really think about how I wanted to do things. So one of my big issues, aside from the fact of helping mitigate the issue of medical errors, communication within these industries is just so broken down. And again, technology has a lot to do with that. So after working with providers small healthcare providers. When I say small healthcare providers, private healthcare practices, I mean practices from 5 to 300 employees. I'm not talking about huge health systems. I'm talking, they have capacity, they have resources. A lot of them are federally funded. I'm talking about business owners, providers who own their own business and practice healthcare as a medical doctor. Okay, those are the people I'm aiming for, because that's the piece of the industry where the resources that they have access to as the provider are limited. When you run your own business, you don't quite have the same resources that somebody in a Fortune 500 would, maybe not right away anyway. So you have to kind of do business in a way where not only can you still maintain the concept of helping people, but you still have to be able to make money. So my goal is to work with these providers, assure that their process is efficient, help them take on some of this extra capacity that they shouldn't have to face. These questions, to sit on the phone with somebody in a doctor's office when you're checking in patients and explain their bill to them can be extremely daunting. And I know it doesn't sound like a lot when you're maybe thinking from a patient perspective, but I tell patients sometimes, when you call your doctor's office, whatever you're asking, imagine if 15 people are calling at the same time trying to get the same resolution, because a lot of times that's what's happening. But if I could come in and kind of enhance, be an addition to these provider services, some of these extra questions, some of this extra explaining that they aren't obligated to obligated to give you, because some of this is the patient's responsibility. So some of the things that the provider is not obligated to tell you, but they do, sometimes it maxes them out to capacity. If I could take on the capacity of those extra constraints, that extra time the patient needs. Patient needs to get on telehealth. They're 75. They don't know how to use their smartphone. Let me come to you. Let me get there 15 minutes before your appointment. Let me show you how to do this. Let me physically be there and show you. And when I can do that, it helps the efficiency of the provider. It mitigates medical errors because you have a second set of hands going through documentation, making sure dates of births are correct. Doctors won't even get paid. When they submit claims electronically, if your date of birth is in the system wrong, they don't get paid. It's just something as simple as that. If your address is wrong, the claims bounce back. Imagine if you had someone like me to actually call these patients in the interim, in between them coming in your office. Hey, people switch numbers all the time. But if you're keeping communication, there's no reason you shouldn't be able to get these updates. But they just don't have the capacity with what they have going on.
How can people reach you?
So I'm on LinkedIn. I have a personal email address, which is included on my website. I can put my website in the chat if you'd like.
Yeah, people want to get in touch with you.
Let me see. Bear with me.
You can put it in the private chat, and I can just copy it and put it on the screen.
Okay.
Or you can put it in the comments. There we go.
You got it. My direct phone number is on there. My email address is on there. I'm very responsive. That's a big thing for me because a big piece of what I do is communication. So one of the things I do like to reiterate to everybody is one of the challenges that I had with my specific business. I want to help providers because I'm very well aware of what their unmet challenges are that they face as they try to service people. But I also wanted to help patients because I can see where the disconnect is distinctly. And there's no reason I couldn't close this divide between the two. But I didn't want to provide services to patients and I didn't want to charge them. I felt like that completely defeated the purpose of what I was trying to do. So typically when I work with patients, it's because I work with them through their provider. The provider uses me through process operations and efficiency. And then as part of that service to the provider, I work with their patients to connect. We make sure the process is straight and we make sure the patients understand. Because if the process isn't straight, we don't want a bunch of patients going there. And if the patients don't understand, that doesn't help the provider. So my goal is to connect the two. And that's why I'm kind of the middle between the provider and the provider's patients. Now, when it comes to my public service and what I do for my business on my free time, I try to do a lot of public speaking. I try to do a lot of education. But I even tell patients, there may be certain circumstances depending on what the month looks like for me, where I take patients on directly in a dire need. And I just personally help them, because I don't even want to say part of my business. That's just what I do. But in order to typically get to me and not have to charge a patient, I work with the provider. The provider hires me for services. And then as part of their services, I deal with all of their patients. So one of the things I tell patients when they come to me directly, here's my card. Let me help you in the meantime. Absolutely. But let your provider know if you're happy with my services, and tell them that I can do this for their entire practice if they like. It helps with marketing, number one. I still don't have to charge the patient. They still get the help they need. And the provider now knows that I'm accessible. The biggest piece of my business is accessibility. I just need to get out there. I need people to hear this. I need the platform. I need people to understand, because with everyday life, working full time, kids, husbands, school, everything, I completely understand. Things like medical insurance aren't at the forefront of
things like
people's
being
minds.
on hold for 40 minutes only to get some person come to the phone and talk to you like you're a 3-year-old makes you want to reach through the phone and choke the puppy crap out of them. I'm just being honest.
No, I experienced that myself, Doni. That's one of the reasons I started my business, so I can be the connection. So you don't have to talk to that person. Let me deal with that person, because I know how to deal with that person. But that's not for the patient who needs help. I explain to these people a lot of times, customer service is a whole different thing. But I explain to people a lot of the time, when people and patients
they talk to you like you stupid, Ashley.
I understand. And when people come to you frustrated and mad and sick, and the last 3 people they talked to just bounce them back and forth, you on hold for 3 hours, then they hung up. Now you got to call back. Oh, I got to transfer you to this line. It's ridiculous.
It makes you want to find out where they at.
It's so funny you said that, because I had to mention that to somebody the other day. I heard them talking to somebody on the phone, and I said, are you talking to a patient like that? I said, you need to realize that you are in a physical location. And I think of everything like this. What if that was my mother on the opposite end of that phone? That's how I think about everything when it comes to my parent. So when I hear things that are off, I have to ask myself, if somebody was talking to my mother like that, what would my reaction be? And you have to be very careful, because people don't play about their mom. So my point is I understand your frustration and I understand what you're going through, but that's why my business is here. Let me take on that frustration. I know how to navigate through that. No, it shouldn't be that complicated for the average person. The fact of the matter is that it is. So instead of me trying to figure out what is right now, how can I fix it? I'm a problem solver. This is the problem that we have. How do I mitigate this issue? You don't want to stay on hold for 4 hours? Let me talk to the appropriate people. If I have to stay on hold for 4 hours, I absolutely will. But I will call you back with an answer and avoid all that frustration for you. And a lot of times it ends up in some type of benefit to the provider when I'm able to do that, and to the patient. Everybody wins all the way around.
I want to shift gears for a second. And this has to do with the way we treat each other on the phone. Not just health insurance.
Everybody.
Fast food, city hall, the public school system. Give me some basics. Because, I used to answer the phone. I first started answering the phone at my dad's funeral home. I'm sure I was about 7. And my mother trained me properly. Good evening, Glover's Funeral Chapel. How may I help you?
So
what happened to that?
I wanna.
These people get on the phone like they doing you a favor, and it's like it's your job. How about this, Ashley? I'm venting now. You done got me started. What you want? What I want? Who let this answer the phone?
So that is a pet peeve of mine, Donnie.
Who is your
Phone-
mother?
Phone
Who is
etiquette.
your father? Where you
Phone
come
etiquette.
from?
Phone etiquette, and like you said, this is just across the board with industry. I want to say a piece of it is generational. I want to say that's a contributing factor, because I know a lot of the things I hear and receive. If my mother heard come out of my mouth, and I'm a grown woman, I still want to let. There's certain things you just don't do, but that's another reason why I focus on the elderly community. When somebody is, it's a lack of compassion and care. I want to say it's a lack of compassion and care. And the reason I say that, people need to learn how to detach themselves personally from professional circumstances. So it's about a mindset. When I get an angry patient, they call me in. Oh, this one said this and da 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 da. First, a lot of times, I will be very honest about this. A lot of times, patients have a reason to be upset. And a lot of times, the reason they're upset could have been resolved in the very first interaction they had. But what happens is people are so overwhelmed, so preoccupied, that things are becoming so standard. I call it the mechanical response. That's not my department. Let me transfer you. I don't do that. Let me transfer you. Oh, that's not my department. No, that's not your department. Do you have access? Can you look at it? You need to let people know you at least tried. There's times where I can't always get a resolution. Honesty is key. You have to tell people, I apologize. This happened. You're not apologizing personally. No, I didn't do this to you. I'm sorry that was your bad experience. Whatever I can do from my position to fix this for you, I'm going to do it. And that's why I get results. If I start passing things off, and especially with these places like food pantries, I hate to say it, sometimes churches, some of these places where people are supposed
you
to
said
go,
it. Church.
some of these places where that are designed, the social service office, these, you know what? I had to go with a client to the child support office in Montgomery.
Oh my God.
No, listen to me, Donnie. Donnie, listen to me. When I tell you the people were so polite, so respectful, it was an isolated event because I did not go in there with that mindset. Now, of course, you don't treat people that way, but my mindset was different when I walked into the office with the client. Everybody spoke. Everybody was polite. Everybody, I could understand clearly what they were saying to me. Everybody was friendly. It was the best experience I ever had. One of the best experiences I ever had. Was this Mondawmin? Yes, the child support office in Mondawmin. Those women were nice. The security, and
I knew it wasn't Baltimore and Charles.
But
no, Baltimore Fayette. I knew it wasn't Baltimore Fayette. Now they got some good people at Baltimore Fayette. I'm a veteran. Baltimore Fayette has some of the greasiest people. You had to navigate 5 or 6 difficult people before you would get to a person with empathy.
And what happens is people would rather just stop and not deal with it than go through the 5 and 6 people to get to the person with empathy.
That letter in the mail.
And I even understand that. Sometimes it's like, man, I'd rather not even do this. But again, I keep saying this, but that's what I'm here for. I have seen it. I've experienced it as a patient and a healthcare professional. I can navigate. Stuff like that doesn't bother me. My thing is results. I tell my patients on the phone all the time, whoever made, and that's the other thing, who's supposed to advocate? If there's an office, a mental health office or a methadone clinic, and I have 8 patients telling me the same bad circumstance, having the same bad experience, who reaches out to somebody of some authority and says, hey, this is what your patients are saying, not me, but the people you serve, this is what they are saying. Do you know how vital that type of information is to a company, to know how your people that you service feel and think about you within your community? Word of mouth, I don't care how technology goes. Word of mouth is huge. Okay, it's huge. Whether good or bad, it has a very huge impact. And as a business owner, I could only respect somebody giving me that information. But who can even make these connections if everybody's just doing what comes at them? But that's what I'm here for. If I notice 10 people from the same methadone clinic or the same mental health, but it's not about filing a complaint or getting people in trouble, a lack of knowledge. Who goes to that provider and says, hey, I'm working with about, 20 of your patients and 18 of them have this issue. I
ran
took all
across
that
this
work
lady
out.
at child support, and her name escapes me, but she did work at Baltimore Charles, and she was quite a gem. Her name escapes me right now, but she was, after dealing with so many, and it's like you go in there and people be like, I didn't sleep with you last night. Don't be mad at me. Or you get treated as a black man, you feel like you're a criminal.
I understand. I was talking to my husband the other day, and we were talking about, when I was younger and I lived in Baltimore, my family, I used to sell snowballs on Pennsylvania Avenue for like 4 summers when I was younger.
What?
Pennsylvania North Avenue, right over off of Salem and Kensett, off of that area. And there was a Penn North Revitalization Corporation right there on the block. And right there in front of there is where I would sit. And I would sell snowballs and people would come up there for ice and I'd be out there. There was a store right there at the time. What was the name of the store?
By the funeral home, the intersection, the tri-section.
The CVS where the whole incident happened. If you go a little further up, if you turned right and the CVS was on your right, you go like a half a block up right there. And I think, what was it? Kensett and Salem were parallel, I believe. And
yeah.
And I used to sit out there, sell snowballs. People come. I'd have my daughter with me. People with my brother-in-law at the time had a store, a little small corner store right behind me. He used to do a lot of work in that community. There was a rec center over there where the basketball court is behind that school. But a lot of this, that's kind of where my focus lies, just because that's kind of where I'm familiar with. But a lot of this is about people, Doni. I don't like to stereotype. I don't like to do groups, but as
white. It's not even about race. It's
no.
Caring.
What I'm saying is, we as individuals have to change our mindset. I was even listening to I believe his name was Kevin Sherd yesterday on your show, and he was talking about mental health in jail. And a lot of Black people, we grow up in the sense of, oh, don't be telling everybody what goes on in my house. Oh, don't. And at that time, I understand that presence of mind. But the people who were raised in that era are now adults. And now the world is telling them to spill their feelings to everybody, or to a therapist. One of the big things that bothers me is people will look you in the face and say, I understand. I understand. A lot of times they don't. There's a difference between understanding someone's situation and genuinely relating. I can genuinely relate to a lot of hardship and underserved circumstances. And I think that's why I can have a better effect on how to approach them, how to resolve them, and how to mitigate these types of issues within our community, within any ethnicity. But I say underserved. I don't care what color you are. Nowadays, it's broke and not broke. You know what I mean? These are the categories we have. So when it comes to broke, sometimes I understand. You know what I mean? I understand. I've just been in so many bad situations where if somebody would have just said just something or just a little something, it could have changed my whole perspective and outlook on how I approach things. But again, I use methadone clinics, these outpatient method and inpatient, these mental health treatment. People are coming to you already in a broken down state. It takes a lot, especially for Black men, to say, I need help. Because a lot of times when somebody says that,
fool, make you want to reach through the phone.
Exactly. Yes.
And choke the puppy crap out of.
You're exactly right. So
You
even
damn
from
stupid.
I know I'm not a black man, but from a black woman's perspective, I'm fairly smart. I feel educated. I feel like I know about certain things. You know what I mean? But
And then
that
you
doesn't
feel
mean you should
insulted.
talk. If I had to walk into a methadone clinic as a patient, don't treat me any differently. I'm coming to you for help. And the way they treat these
My
people,
medicine.
yes, and people don't even tell people what they're supposed to do. I observe. When I go with my patients, I watch. I don't say a whole lot. I need to see what's happening. Sign these papers, sits them over there. And then I have to sit with the patient. A lot of them, how do you know if this person can even read? And you were so nasty when you gave me the papers. I'm so uncomfortable to tell you that I can't read that I'm not going to even understand what I'm signing. But how do you even get that deep into somebody when you're just so nasty? But if you have somebody with you and you can see that they're genuine, people real recognize real. I grew up on that phrase. And when someone is genuine and their genuine intent is to genuinely help you, people normally pick up on that and feel it. And when you do, take it, not take advantage in a bad way, but capitalize on those moments because those people are rare. But when you find them, they're willing to be. A lot of people in those situations have been in those other situations. So again, at the summit, at the small 2025 Black Summit that we did at the museum a couple weeks ago, when Miss Black Wall Street was talking, she said everybody looks at the car and the clothes and they think, oh, she got it all good. But she mentioned, people don't connect the struggle that goes behind getting to that point, and not even behind, with, because it's active every day, day to day. My own situations in my own personal life that have somewhat influenced what it is I'm doing, because I have been there where, again, hard times, food stamps, I need them. No, I don't want to be here. I'd rather not need to be here. But now I call, I can't upload my papers.
Now you done started something. I remember, this is 40 years ago. My mother worked all her life and she was dying of cancer. And the welfare office, that's what we call it, ran on Smallwood Street, ran her ragged. I was with her just to get some damn food stamps. Yet I had a cousin who'd been getting food stamps for decades. And it's amazing how you can work your entire life serving people, but when you need help, it can seemingly be impossible. And again, to have some smart ass behind the counter,
well, that's
give you a clipboard and say, "Hey, go fill this out." It make you want to choke the puppy crap out of them.
Here you go. That's
Yeah. Meanwhile,
that line over there. I know, but again,
why did you agree to be on the panel for the expo? And did you enjoy the last event?
I did. I really did. I really did enjoy it. So first of all, the resources that were there, and the people and just the magnitude of person that was in the room empowered me. I was like, yeah, I was like, I'm a part of something. Like, you know what I mean? Like I said, I've been working on my business for a long time, but I just got my incorporation and all my legalities really together spring of last year. So I'm still fresh from a corporate perspective. And it just really put me in touch and in contact, like something, it was Carl Brown. He made a comment that really resonated with me. And he said, I've done these events before. And he said, I've seen it, and less than 10% of you are going to utilize these resources that have been presented to you. I said, jackpot. I said, because if less than 10% of these people are going to utilize these resources and I make sure I do, I can't help but stick out, because I'm going to be the one person that people remember from in this room. You know what I mean? I know a lot of people already knew each other, you know what I mean, and had worked together, but being a fresh face, soon as he said that, I was like, 10%? No, that's not that competitive, but that's very low. So if I can even capitalize more on that 10% and be the one, I have to stick out. And that's what I did. I try to find the cracks and flip through them. I try to find the direction everybody else isn't going in, but it is still successful to get me from A to B. I don't want to, people have a tendency to always, again, think of the many, think of what's the most, think of what's more, not realizing sometimes in certain circumstances, less can be more. I try not to speak from a large general perspective. It really depends on the specifics of the circumstances. And I'm realizing that a lot of things need to be taken on a case-by-case scenario. Because again, even with Maryland Health Connections, the many is getting through, but what is the difference between the many and the people falling through the gap? Because eventually the people falling through the gap, the scales are going to tip and they are going to be the many. But that's when people start to change process and try to fix things. I don't want to fix things. I don't want a problem at all. Let's prevent them. Let's mitigate them. Let's reduce them. If I have to be reactive, I will, because I'm a problem solver. But I don't want problems at all. I don't like problems. Let's prevent these problems. And no, you're not going to be able to, predict everything that's going to happen. But if you have a baseline idea in your life, in your business, whatever, if you have a baseline of what it is you hope to accomplish, you can kind of go through life. And then if things go downwards, you adjust. If things go upward, you adjust. But at least you have that baseline. If you don't have a baseline, if you have no expectation, I always tell the people I manage, are you clear on your job responsibilities? I cannot hold you to a standard if you do not know what that standard is. So when I've come into places and I've managed as, behind somebody else, one of the first things I do is, what is everybody supposed to have access to? Does everybody know what's expected of them? Because if I go to do your review and I tell you that you're not doing this task and your last manager didn't tell you that that task was part of your responsibility, that's a miscommunication. I like clear communication. So let's just set the standard now that Ashley's here and make sure everybody's aware of what's supposed to happen. Because now, if you do or not do it, I know you knew what was expected of you. So, it's a people thing. It's a mindset. And it took me, if you knew me about 10 years ago, Doni, I tell you, there's no way you would believe that I'm sitting in this chair right now saying these words to you out of my mouth, because I have a hard time believing it. And I tell you, it is only by the faith I have in God and the support of my family that I'm even sitting right here doing what I'm doing at this point in time, but I enjoy it. I love helping people. When I make a patient happy, it makes me so happy just because I would love for somebody to do that for me, my husband, my child, my mother. I specifically think of my parents who are in their 80s. I told you my father passed away, but I think my mom, yes, she can call and text. But when I think about certain things, I'm like, what would I do with my mother? This is what I need to do with this person. You know what I mean? And you just gotta roll with the punches. But I'm big on giving back. I'm blessed. I have no problem saying that. My faith has carried me through. And like I said, we'll have to trade war stories one time. But me sitting right here, even talking to you right now, having this platform is just immaculate for me. It's a huge step for me.
Thank you for joining us this morning, Ashley.
Thank you.
Good morning, world.
All right. Take it easy. Be blessed.